Hi there, this is Koichi Naruishi and Dr. Carolyn Candido. We're here from Carlsbad Integrative Medical Center, and on the last post you have seen me get blood taken, and that was for the Spectracell analysis from Spectracell Laboratories to see what kind of nutrients I might be deficient in or what I need to kind of boost up. And then we did the Dunwoody laboratory, and we have the results here. So we're going to take them in two parts. The first one is going to be from the laboratory report from Spectracell, and Dr. Candido is going to give me a little report and some feedback on how I could improve my health.
Yeah. Okay, so the micronutrient test from Spectracell looks at intracellular micronutrients in lymphocytes instead of looking at the serum. So you actually know what your cell is deficient in. So when we did Koichi's test, it showed that he did have deficiencies in vitamin B1, B3, glutamine, and CoQ10. But when I look at the overall picture, I also take into account also the borderline deficiencies. So he has pretty much deficiencies in all borderline deficiencies in all of the B vitamins, in addition to so B2, B6, B12, folate. Those are all B vitamins, as well as glutathione and vitamin A and inositol. So those are also important for other factors. So inositol is great for the brain, glutathione's detox. Vitamin A is really important for immune function and skin. So there's a lot of different borderline deficiencies. Instead of just looking at overall, like looking at the deficiencies and start supplementing there, I like to look at the root cause. So even looking at borderline, you can look at the whole big picture pattern. So here he has a lot of antioxidant deficiencies, which are CoQ10. Is vitamin C on here?
No, glutathione is one of them too.
Yeah, glutathione is one of the antioxidants. And then all the B vitamins, those are borderline or deficient. So if you want to look at overall patterns, they have a really great handout on from Spectracell that kind of looks at overall patterns for example, adrenal fatigue. So even just based on the micronutrient deficiencies or borderline deficiencies, you can see like what is the root cause. It could be from adrenal fatigue, because adrenals have they use a lot of B vitamins as well as antioxidants, and inositol is also listed here, as well as CoQ10. So all of these things we're deficient in, and vitamin A, of course, we're deficient or borderline in Koichi. And so when I address the micronutrient deficiencies, not only am I going to recommend a multivitamin that includes all of these, or specifically a B complex and something that has also antioxidants, I would also look at like, why is he having adrenal fatigue? And that can be, due to stress in life. Everyone has stress. And you could support the adrenals, and giving supplementation through the micronutrients can help the adrenals be able to withstand stress, the everyday stressors of life. So it's really important, I think, to look at why we're having micronutrient deficiencies, and then if you treat them, then you can actually improve the reasons why people are having adrenal fatigue. Also, just in general, fatigue itself can be caused by vitamin deficiency. So I think it's a great test, and it's a really simple test to draw, and I think everyone can benefit from micronutrient analysis. Thank you.
Thanks. Thanks, Dr. Carolyn Candido. And yeah, and we'll go to, this is functional medicine. So we're looking at the root cause of what's happening. So we're looking at the vitamin, and the big part, I think, was stress as well. So there's a lot of things going on, and there are a couple things and tidbits I can add to this post as to, and resources to Spectracell Laboratory and things that I've been using to help me reduce my stress levels. Okay, thank you.